As far as the demand in our field, it's very high. We recently hired 5 new people. We typically like to draw, now you don't have to go to school to do what I do. We train people on demand if we find the right candidate, just because it is so difficult for us to find someone from school. But we really do prefer graduates of a technical program, or sometimes there are some college programs. Currently in Wisconsin, Madison Area Technical College and Lakeshore Technical College are the only schools that offer a ophthalmic technician or optometric technician level program. There are 3 levels of certification within the field that I do. There's the ophthalmic assistant, the ophthalmic technician, and the ophthalmic medical technologist, which I am at. So over the years you work toward each of those. If you graduate from Madison Area Technical College or Lakeshore Technical College, you can come out being able to sit for the examination for the certified ophthalmic assistant, the lowest level. In Minneapolis, there's a college out there called St. Catherine's, and we have one technician who graduated from there just this past May. She came in able to skip the lower level and go right on up to the technician level of certification. In order to obtain her medical technologist, she will have to work in the field now for another 2 to 3 years before she can go and sit for that test. Anybody with interest, I've had people approach me, I've had mothers of potential students ask me during an examination, where did you go to school for this? What did you do? If you find that this is something you think you could do, you know, eyes aren't that gross. They're not all blood and guts. If you're a contact lens wearer yourself, you know that there's nothing wrong with the eyes. I would encourage you to call clinics such as ours, inquiring about where the school is. Call your local technical college. They can help you research. Call the counselors in your schools. They can help you research what those are. The one thing that stands with me, besides that very first day when I met with saw inside my optometrist's eye, was the very first time I was allowed to look through the microscope here at the front of a patient's eyes. When you look at the color of somebody's eyes, you may just see simple brown, simple green, maybe a few brown in between it. When you look through the microscope, it's this vast expanse. It's like a sponge, and there's these valleys of color and these ribbons of color running through. It is truly the most beautiful thing you'll ever see. Any artist who would ever exploit that and blow up pictures of somebody's irises, the color part of the eye, I think would be truly inspired.